is in there as well.
Okay.
All right, everybody. Yeah.
Hi, good evening, everyone.
Hello.
Is somebody watching this on TV as well? Because we're getting some
Yeah, we're
feedback.
getting an echo. Yeah.
Right. So why don't we get started?
Chuang is in the waiting room, is she not?
Yeah, I just let her in.
Oh, good. Thanks.
Great.
Here we go.
Okay, I'm going to call the meeting to order. And welcome the public as well. This is actually, I was thinking, this is actually our third meeting in 10 days. We're racing and earning our pay, which is exactly 0, but
I want a raise.
nevertheless.
I want a raise.
We'll double it every week for you, Paula.
Yeah, 5% raise, Paula, right there.
Ade's getting to know us all very well, very quickly.
That's great.
Yeah.
So in terms of reviewing tonight's agenda, we have the minutes from Monday night. We're going to review and vote on the indoor mask mandate that we've been working on since Monday. We're going to get I believe, a brief presentation from Maureen Busby on the new tobacco law, followed by a discussion around a tobacco violation that occurred actually probably back in late November, early December, in November, I think. And Ade will lead that piece. Kevin will update us on anything on the coalition. And there's actually been several incident command updates, which Ade can inform us on, give us a brief update. And then, as usual, we'll have the monthly health department report. We'll open it up at that point to any public comments and plan for our next agenda item, which in the absence of any urgency will be a month from now in February. So with that, to the minutes, which everybody got, were there any comments, questions, edits?
I thought they were beautifully summarized. Thank you, Jackie, as always.
Yes, thank you, Jackie.
Yep.
The one question I had was that we got emails on the topic of an indoor mask mandate, both prior to that meeting, and then we got several after that meeting. And I don't know what the protocol would be as to whether it would be appropriate to append those emails to the minutes. They're not the minutes of the meeting, but they relate to the topic of that meeting where people didn't come present and comment, yet they sent emails in support or not in support of that. And it's just a thought whether that would be appropriate, whether people think that's a good idea or not a good idea.
Okay.
Yes.
Generally, we keep the minutes to that of the meeting itself. I think historically what the town has done across boards is if you get emails in, you can include them as part of the packet. So then part of the public record going into the meeting. But I can't remember anybody putting emails that weren't read in the meeting. In other words, if someone wanted to read those emails during the meeting, they would then become part of the meeting, would be my feeling on it. So I don't know that it's something you'd make part of the minutes where it wasn't part of the meeting.
Part of the meeting. I know that the select board used to publish all these emails and then they changed their protocol around that. Okay, it was just a thought, because it was interesting that there were virtually almost all of those were in support. And it just seemed like a more balanced view than the minutes necessarily, which are accurately represented, but in terms of trying to get a sense of things. So with that, I'll make a motion to approve the minutes from January 3rd. Have a second. Paula, second. Roll call. Carrie,
Yes.
Paula,
Yes,
and Rick, yes. So the minutes are approved as is. Next, the public indoor mask mandate. So what has happened since Monday night is that we've drafted a mandate order for indoor public masks that is fairly detailed, that's been reviewed by council, that has had input from all the board members. And what I think we could do is have Jackie share that document with us. I think that because members of the public have not seen it, I think we should walk through it. And I can do that in a couple minutes. And then have any final comments or suggestions from board members and then take a vote. So basically, this would be a motion that, we've met tonight and we've adopted the following emergency order under the provisions listed there and all other authorizing statutes. And the order is based on a review of the current COVID caseload, positivity rates, both in the town and Middlesex County. And we would be voting to adopt a public health mandate of a indoor mask emergency order in the town of Reading. So the points of this mandate would be as follows. Effective tonight at 12:01 a.m. Face coverings would be required for all individuals older than 2 years of age in all indoor public spaces, houses of worship, public meetings, or private spaces open to the public, except where an individual is unable to wear a face mask due to a medical condition or disability. The board highly recommends the use of N95, KN95, or surgical masks. And due to the transmissibility of the Omicron variant, cloth masks alone are strongly discouraged. Public meetings are strongly, and this would be public meetings, commissions, boards, committees of the town, strongly recommended to be held remotely, except where in-person meetings are deemed essential by the chair. Food service establishment customers may only remove their face masks when seated and engaged in the act of eating and drinking. If there are indoor performance venue, the customers thereof may only remove coverings when engaged in the act of eating and drinking if that's permitted at the venue, and the performers may remove their face coverings if they're at least 6 feet from the nearest customer or attendee. Residents, employees, and guests in multi-unit homes and apartment complexes are required to wear face coverings when inside hallways and other common areas. Fitness, health, and health club workers, customers, and visitors are required to wear face coverings during fitness activity, including strenuous activity. At personal service establishments such as barbershops, hair and nail salons, all customers and workers are required to wear face masks. Coverings except for skin and beard care that occurs in the face, where the customer may temporarily move the covering, but must immediately put the covering back on for the remainder of the visit. Masks remain mandatory, and this is a state mandate for individuals on public and private transportation systems of various types, in healthcare facilities and other settings, hosting vulnerable populations such as congregate care settings. and that's directed by the Mass DPH. There was some confusion about this. So number 9 says the order excludes entities licensed by the Department of Early Education and Care, which are required to follow EEC guidance. However, the order shall apply to entities operating as daycare that are not licensed by EEC. And this order excludes the Reading Public Schools, which are required to follow guidance from the Department of Elementary and Secondary Education. However, Reading Public School buildings and facilities, when used for non-school related activities, are subject to this order. All entry doors of businesses open to the public must post notice advising customers that face masks must be worn inside the establishment. Establishment staff must supervise and enforce this requirement if a customer refuses to wear a mask or face covering for non-medical reasons. The business must decline entry of the individual to the business to avoid violation of this order. To the extent required, the order shall be enforced by the Reading Board of Health and its authorized agents. Violations of this order may be punished by a civil fine if after a verbal education and written warning of $300 per violation, in the manner provided for non-criminal disposition of violations by the appropriate Mass General laws. And finally, this order will be reviewed by the Board of Health at each subsequent regular meeting and such other meetings as are posted by the board and shall remain in effect until rescinded. We will presumably take a vote, and that's it. So that is the mandate order that we're discussing. Are there any additional comments, suggestions, questions? Yes, Kevin.
Jackie, could you pull that back up, please? I just had one thing I picked up on, and it's a slip of word kind of thing that I just want to get somebody's intent on. So I think it might change it. Scroll up to the next, I think it's on 11. Let me just see where I saw this, the civil fine. So if after a verbal education and written warning, I read that as I can tell you you need to do it, and then when I come back, I'm going to write you a written warning the second time I come out. Is that the intent, or is it a verbal education as you're giving them a written warning at the same time? Because otherwise, if it's two things, if it's two instances, then it's fine. If it's meant to be one instance, it should be a verbal education while giving a written warning. Do you see where I'm? So yes. I don't know the intent of that line. It depends on what the intent is.
I think the intent, but I think this is something that I know that the town council was involved in. I think the intent was that this was a single instance of verbal education and written warning. And so maybe it should say, in a day, if you were sort of coordinating all this, if you understand this differently, please let us know. But otherwise, it could be changed to verbal education coupled with a written warning.
Yeah, if that's the intent, it should read better that way. It will read better that way. Yeah.
Okay. And I had one question up at number 1. And I know that we've kind of gone back and forth on this, but in terms of number 1, individuals older than 2 years of age or 5 years of age. I thought the state had under number 8 had done 5 years of age.
5.
Yeah, the CDC has it written as it is here. So it's two different things. It just depends on if you want to go with the state or the CDC.
Say that again. The
CDC has it written as it is right here, as older than 2 years of age.
2 years.
Our state has it as 5. So it depends on who you want to be consistent with, either the CDC or the state.
Okay.
I was fine with either one of them.
And as long as you're more stringent than the state, there shouldn't be any issues.
I'm sorry, say that again.
As long as you're more stringent. So the state is saying 5 and you're going
Yeah.
to 2, you're more stringent, so that shouldn't be a problem. Now, if you go to like 6 or 7, then that would be a problem.
Right, that would be inconsistent.
So I guess
Okay.
it comes down to whether you want the youngest in like daycare centers and things like that to wear masks or not, right? Because if you want that, then it's written well. If you want to be lenient in that age group, you could go with the state. Because that's who it really will affect more than anything.
Yeah, I mean, part
More
of
than
it's
the supermarkets and what have you.
right. I mean, part of it's the practicality of a 3-year-old wearing a mask.
Yeah.
Paula, you're a pediatrician.
My granddaughter wears her mask. She's not yet 3.
She's not that, okay,
So, and those are the kids, those are the ones that are spreading it.
that's true.
Not that I really hate to do it. I
Mm,
really hate to do it.
Yep.
But they're not vaccinated and they're the ones spreading it.
okay. Okay, we can just leave that, and it's consistent with the CDC, so. Any other comments? And if not, I would call a motion to adopt the the mandate as written here and as we've discussed.
As
Yes,
amended.
I have a question.
yes.
Should we take public comment before we do this?
I feel like we've had more than adequate public comment. And, we've discussed it. We discussed it in a public meeting on December 27th. We held an extensive public comment on Monday. We have received emails as well. I think there's been more than adequate
Okay.
time for input. It would be my assessment. Do I hear a second?
Happily.
Okay. Roll call, Carrie,
Yes.
Paula,
Yes.
Rick, yes. Okay, so the public indoor mask mandate passes.
Rick, if I may, before we move on from this,
Yes.
I just had a couple of comments now that this is going to go into place. Just remembering back to when the last time this board put a mask mandate into place. There was a couple of good ideas. I was actually perusing some groups on Facebook, as I tend to do during the day, and there was one of our residents, a well-known resident, had a great idea in regards to getting out the education on this. I don't know if it's possible or not, but the thought came up about a reverse 911 call out to the residents to inform them of what's going on now as of 12:01 tomorrow, that there is now a mask mandate. People are going to be sitting in their homes tomorrow morning, and would be actually a great opportunity if we could pull it around that fast.
Great idea.
And I thought that was a great idea to get it out there to everybody. And there was a couple other things that I just wanted to bring up for those folks that are watching, all 10 of you. The last time we had this, the police were overwhelmed with calls from different businesses and establishments stating that somebody's not wearing their mask. And I just want to reiterate, the police are not the enforcement arm of this. I'll say that again, the police are not the enforcement arm of this. It's the health department. If you feel the need to really make a phone call, you can call the health department. If not, you can grab a manager's arm and just point it out to them. Please, please, please don't go up to people out in public and tell them they should be wearing a mask. It's very confrontational. You don't want, there's no reason to do that. There's no reason to get that close to somebody who's not, if you feel that strongly about it. So I just want to put out those kind of public pleas to do so, just because I know we ran into a lot of that the last time this happened. So again, 2 things: please don't approach people who are not wearing masks to complain about them not wearing the mask. You can do so to the health department. You can do so to the managers of the establishments, and please don't call the police to report these. That's all I have.
Thank you very much for the comment. We have a phone line dedicated to the public. If you have any concerns or questions about this, the phone number to call is 781-942-6680. I repeat, 781-942-6680. Thank you.
Thank you.
And I'll go. And I just want to say one more thing. Sorry, keep interrupting you, Rick. And for those that are going to have an issue with putting a mask on going into these establishments, please give these businesses a break. They don't want to impose this on you any more than we do. You know, we're all in this together. I think the history we look back on this says that things that burn up this fast as this is going through the roof, usually comes down just as quickly. And hopefully that's going to be the case. It's a little push to get through it. You know, we're all neighbors and in a community, and the people that are imposing this and that are going to be asked to impose this don't want to bother you in that manner, and we're imposing on them to do so. So give them all a break. Just think about it on those terms. All right, it's my last public plea.
Thank you, Kevin. Good points.
And I would like to make a comment just to address the board on the vote. I'd like to thank you all very much for not defaulting on your obligation to protect and promote the health and well-being of the citizens of Reading. In an environment where health officials like me and boards like you have been bullied into silence and inaction, you've demonstrated to the people you serve that you have their best interest at heart. I want to commend you for sticking with the facts and making the right decision for our town. Thank you very much.
And thank you for all your efforts, Ade, in pulling it all together.
Absolutely. Thank you. I think the idea of a reverse 911 is definitely worthwhile doing. I mean, if we can get those because our rubbish is being delayed, I think this is a much more important issue. And so Ade, if you can certainly follow up with that. I know the town likes to use that communication vehicle sparingly, but I think this is one time that it should be. I also think that the signed mandate ought to be posted on the Board of Health website somewhere, or a link to it, so that people can read the detail if they so desire.
I will follow
Yeah,
up. Thank you very
great
much.
idea.
Great.
Are we sending out signage for everybody? Did we already do that? That they can post on
Right.
their business.
I don't know,
on the
Dave,
doors?
did you?
They will be mailed out tomorrow.
Oh, oh, good. It's going to be mailed out, because I know the email isn't full of every business. So, okay, good.
I mean, and you know, that kind of poster as a PDF could be also posted on the website. So if someone doesn't check their email, they can go and pull it off, print it, and put it up.
That's a great idea.
Yeah. Right. Anything else on that before we move on? Right. Okay, Maureen. And maybe a day you can introduce Maureen and the work she does for the town.
So pretty much, Maureen, are you there?
I am.
Hi, how are you?
I'm good. And thanks for having me this evening.
Matter of fact, I'll let you introduce yourself. I think you'll do a better job.
Okay, my name is Maureen Busby. I'm the Regional Tobacco Program Coordinator. Currently, I am funded to serve 5 communities: Malden, Medford, Melrose, Wakefield, and Winchester. But prior to the current grant, I used to also have Reading and Stoneham in my collaboration. So I've worked a lot with the prior Reading boards of health, and you have a lot of really good local tobacco regulations. What I'm going to do this evening, though, is focus on the newest state tobacco law. And I'm going to read from my notes so that I don't skip anything, because the law is actually pretty comprehensive. The law was signed by Governor Baker in December of 2019. I can't believe it. But right after that was COVID. And so we are still educating retailers and those with enforcement authority like yourselves. As I said, it's a very comprehensive bill, which includes smoking cessation benefits, covered providers of cessation counseling, tobacco prevention funding, as well as the provisions that I'll focus on tonight, those that relate to tobacco sales. And my goal in doing this is to provide some context for future decisions that the board may have to make. Probably the most well-known provision in the new state law is what we refer to as the flavor ban. Effective June 1st, 2020, flavored tobacco, that's cigarettes, cigars, chewing tobacco, nicotine pouches, rolling paper, and flavor enhancers are prohibited. Flavored vape products are also prohibited, except in smoking bars for on-premises use only. And while past flavor restrictions exempted mint and menthol, the new law specifically includes mint and menthol. Massachusetts is the first state to adopt a full flavor ban. Another provision in the new law changes the amount of the fines for violations. Prior to this law, the state fine structure was $100 for a first violation, $200 fine for a second violation, and $300 for a third violation. Under the new law, the new fine structure is $1,000 for a first violation, $2,000 for a second violation, and $5,000 for a third violation in what we call a tolling period, which is now 3 years long. So we look back, essentially what we do, if there's a violation, we look back 3 years, were there any other violations, and is this violation a first, a second, or a third? A DOR license is required for vape products, so this is new under the law, so the Department of Revenue can collect excise taxes. Prior to this law, sales taxes were collected, but not excise tax. Now a retailer may need up to 3 DOR licenses, one for cigarettes, one for cigar and other tobacco, and one for e-cigarettes, depending on what they choose to sell in their store. A retailer may also need up to 8 signs, a minimum legal sales age sign has a big 21 on it, a summary of the new state law, flavor ban, e-cigarette warning, cigar warning, a no smoking, no vaping decal for the door, the quit line phone number, and entrance restricted to 21 plus for adult only retailers. Reading doesn't currently have any adult only stores. Retailers must now ID all customers. Formerly, they were required to ID anyone who looked like they were under the age of 27. Now they must ID every customer who purchases a tobacco product. And by the way, when we say tobacco product, because the tobacco definition was changed in the law prior to this law, any vape product is considered a tobacco product. So whenever I say tobacco, it's all nicotine products, all vape products. Another new change, all sale to minor violations trigger a suspension of the retailer's tobacco permit, even a first offense. This is not true of other violations, such as the sale of a flavored product. If you sell a flavored product, you still get a fine, but a suspension is not triggered for a first offense. Subsequent offenses, yes. A manufacturer's letter is required for all tobacco products, attesting to the product ingredients. That's so we know that these products, and there are new ones all the time that we're not familiar with yet, that's so that we know these products do not have added flavor. A manufacturer's letter is also required for all vape products, attesting to the nicotine level. Under state law, nicotine levels for vape products, except in adult only stores, cannot exceed 35 milligrams per milliliter. And stores cannot advertise products that are prohibited. So no more big green menthol Newport signs. The stores have been very good about that, especially in Reading, taking down signs that are not allowed or that advertise products that are not allowed. And also mainly the distributors are the ones who provide the signs. So the distributors took care of taking out the flavored signs and putting up, new Newport red signs. Other older provisions of state tobacco law still apply. Purchasers must be 21 years of age. Pharmacy sales are banned. No smoking or vaping in any workplace. Local Board of Health permit is required. No coupons allowed. No out-of-package sales. Liquid nicotine containers must be child safe. Humidors and other self-service displays must be locked or out of reach of the customer. And local regulations still apply. In your case, permit cap, proximity ban, cigar minimum price. Those regulations still exist, and we still enforce those. So some boards, rather than meet each time there's a sale to a minor violation, voted to impose a set number of days for any first-time violation. And 3 days seems to be a popular number among communities that I've heard from. Remember that a second violation in a 3-year period triggers a 7-day suspension, and a third violation in that 3-year period triggers a 30-day suspension. So it does make some sense that a first violation would carry a suspension shorter than 7 days. But the new law does allow any number of days between 1 and 30. So when the board meets to review a tobacco sales violation, the board decides whether they're going to impose 1, 2, 3, 15, 30, whatever number of days, unless you decide to make an administrative vote that all first violations of sales to minors will receive a whatever number. So a 3-day suspension or a 6-day suspension or whatever you might choose if you choose to go that route. Down the road, the board may also want to consider updating local tobacco regs to match state law. State law trumps local regulations, of course, but it's cleaner to have them match. For instance, your regulations currently state that the fine structure is $100, $200, $300 for all fines. You may want to keep local regulations at that level. So for instance, one of your local regulations is a minimum cigar price. So in Reading, any single cigar has to be sold for a minimum price of $2.50 plus sales tax. Any multi-pack, 2, 3, 4, doesn't matter how many, any multi-pack has a minimum price of $5 plus sales tax. It's a local reg, not a state reg. You could keep that regulation at the $100, $200, $300 level, but all those other provisions that I mentioned in the first part of this presentation are 1,000, 2,000, 5,000. So a sale to a minor is covered under the new state law. That would be 1,000 for first violation, 2 for second, and 5 for a third. If you do decide to change your local regs, to update them to meet state regs, and maybe even to look at, some other regulations that you might want to think about adopting, the state program does provide technical assistance. They'll draft a set of new regs for you to look at. And even though you're not currently in a funded program like mine, the state still does provide assistance for new regulations. So that's the end of my formal remarks. If you have any questions, please fire away. Yes, Kevin.
Hey, Maureen, how you doing?
I'm good, thanks. How are you?
I'm doing well. I had just one quick question in regards to the succession of violations. I'm assuming that if the businesses change management or ownership, that stops that, right? So it's not attached to the business, but attached to the manager or the owner?
You are correct.
Okay.
If there's new ownership in place, it's a clean
Goes back
slate.
to zero.
You start all
Okay.
over.
Okay, that's the only question I had.
I have just in terms of the fines and the suspension of licenses for different numbers of violations, are both of those, it sounds like the dollar fines are mandated and specific in amounts. Is a suspension of license a requirement, or can the local board waive that? At least
It is. Yeah, it is part of the state law. And what changed in that was, prior to this new state law that the governor signed in late 2019, there was no suspension required for a first sale to a minor. All first violations, whether it was sale to minor, sale of a flavored product, whatever, didn't have a suspension attached. But a second violation had a 7-day suspension, a third violation, a 30-day suspension. You match that in your local regs. Your local regs in state law lined up prior to the new law. And right now, in addition to the fine structure changing, the other change was that the state imposed a 1 to 30-day suspension for first violation of a sale to a minor. Any other violation, first violation, say if they sell menthol cigarettes, then that doesn't have a mandatory suspension attached. What some other communities did back, almost a year ago, because we were, we had a little delay in rolling out the education piece to all of our retailers, because for about 3 months, we weren't visiting the stores because of early COVID. So we're a little delayed in getting the education out to all the retailers. So what some communities did last year, last spring to early summer, they waived the look back. Some communities waived the look back. So every violation in 2020, every violation in 2020 was considered a first violation, even if the store had a prior violation. The other thing they did was they waived, or they made this was an administrative change that they made. They made the suspension period 0 just for that first COVID year. Now we're past that. There's been a lot of education. I have personally visited every single one of your stores. I've provided the signs. I've talked to the retailers. So this education piece has been done. So while, a year ago, some communities were adopting that unusual step of waiving something that isn't happening so much now.
Okay, thank you.
And just to clarify, the minimum is a day?
A day, right, for the
suspension,
first
and then-
violation of a sale to a minor, 1 day up to 30, and
30
any
days.
number in between.
Yes, Carrie.
Hi, Maureen. It's nice to meet you. I just had one question about the implementation of the suspension. What does the store have to do when they're not selling? How does that work?
Right. That's a good question. So when they sell to a minor or sell a flavored product or any violation that triggers a fine and a suspension, I notify the health director. The health director writes a cease and desist letter, and in that letter will be a date for that one for when the fine has to be paid. But in the case of a suspension, they get to appeal, come before the board. Or actually, in the case of suspension, they can come before the board. The case of the fine, the board doesn't have any authority to change the fine amount.
Okay.
So sometimes stores will ask for an appeal and they'll ask for a reduction in the fine, but the board doesn't have that authority. What you do have authority to do, however, is that one situation of the sale to a minor first violation, 1 to 30 days, you have that. But the other thing is, sometimes I appear before a board when there's been a violation, and I tell straightforward what happened and such a day, such and such a time, a clerk at such and such a store sold this product for that amount to a 17-year-old, whatever it was. And then the board may ask questions, and if there's a violation in the protocol, so for instance, one of our protocols is the youth have to be trained. They can't wear sunglasses, they can't wear a hoodie, they can't wear a hat. So let's say the youth went into the store and had sunglasses and hoodie, and the store clerk said, I sold because they had a hoodie and sunglasses. Under the old law, where we said they had to ID everybody who looked like they were under the age of 27, that might have been something that the board would consider, but they have to ID everybody now. Mm-hmm. So you still, as a board, you could still consider a violation of the protocol, because that is a protocol we have to follow. So sometimes a board will ask me questions, a little bit detailed questions about what happened in the, did you see the youth enter, or whatever it might be. And then the board can decide that yes, a sale took place. Yes, the protocol was followed. Therefore, they uphold the violation. Or no, we feel that, this wasn't done properly, and therefore we side with the retailer. So that's a role that the board has. If there's a suspension, then once the suspension date will be decided, and usually by the board. So if you decide on it, say you decide on a suspension tonight, you decide that suspension will take place effective 12:01, right after midnight on such and such a day. If it's a 7-day suspension, it goes 7 days. If it's a 30-day suspension, it goes 30 days. So when you decide this is just the suspension, you decide the effective date.
Maureen, could you please clarify exactly what the business owners have to do if their license is being suspended?
Oh yeah, I'm sorry, I forgot that part. I got carried away with the process, the protocol. I forgot to answer your actual question. So the retailer has to remove all tobacco products, and again, that includes vape products, all tobacco products from their shelves. Has to be, some communities will say they have to be out of the store. In my communities, what I've said is they have to be boxed, taped up, not easily accessible by a clerk. So no clerk could make a mistake and grab one and sell it during a suspension period. So in a back room, they don't have a back room, then off premises. But some stores have a basement or a storage room or whatever. So boxed, taped up, not easily accessible, or off premises. Any other questions? Thank you so much. I do want to add a postscript. So I did a round of inspections. I forget, I was going to look it up and I forgot exactly when it was, but I was still working with Jean, and I wrote her a note and said that Reading stores were amazingly compliant. So an inspection is when I go in and make sure they have their permits, make sure they have their signage, make sure they have no products on the counter, that they're not carrying products they can't carry, and so on. And Reading stores have been amazingly compliant. And also in that round of compliance checks that I did recently, I think it might have been November 1st, only one store sold. We prefer 0, but one store sold. Frankly, in the other communities where I've been doing compliance checks, the non-compliance was much higher. So congratulations to Reading stores, because they've really done a nice job with all pieces of this, the administrative pieces they have to do, but also not selling to minors.
That's great.
Dave, did
Great to
you?
hear.
Maureen, would you be able to hang around for the next part of the meeting?
Sure, absolutely.
Thank you.
So the next agenda item is we're actually going to discuss the particular violation that Maureen mentioned and Ade has talked about to us as well. And I see that the store owner is in the audience, Nick Patel. Ade, how would you want to handle this?
Yes, I'll just give a brief introduction, and then we can go from there. So pretty much on November 1st, a tobacco compliance check was conducted by Maureen and her team. Square Liquors, located at 13 High Street in Reading, violated the state law by selling tobacco product to a minor. This violation comes with a fine of $1,000 and potential suspension of their tobacco permit. Since then, Square Liquors have paid the $1,000 fine. I think they paid it early December. And from the feedback that I got, Nick and Nikita, they're very sorry for what happened. And they would like the board to explore the option of waiving the possibility of a suspension since this is their first violation. So I'll let Nick and Nikita talk about it.
Hello, good evening, everyone. And hi. Yeah, so I apologize for the incident that happened. And I was the one who sold the Newport product to the minor. And I assure you that it would never happen again in future. And this is a first time, and we'll make sure that it will be more careful in future. And I know we did a mistake and did not check IDs, but I'm extremely sorry for that. And I request you to please cancel the suspension as we already paid, huge fine. And as a small business owner, $1,000 plus suspension would be a huge loss for us. So I kindly request you all to please cancel the suspension. And just a minute.
Thank you very
Yeah.
much.
Thank you.
Yeah. Thank you.
Thank you, Ms. Patel. So this is, there's a couple issues that I see here. One is what to do in this particular case. And it sounds like what the Reading regulations as they currently exist, they're compatible with the prior law, not the current law. And so we actually cannot, in this instance, I think, fall back on our current regulations because they're no longer valid because of the new law. The previous regulations would have allowed us to waive the suspension. Now, as I understand it, we're mandated to have a suspension of 1 to 30 days. I think one issue, just for a day to take back, is we really need to look at our current regulation and update it, working with town council and Maureen and the state tobacco folks, to have something that can come back to this board so we can discuss, and then we would have some guidance in future cases. Fortunately, we haven't had that many cases. I've been on the board for a year and a half, and this is the first one. So there's a policy issue here that needs to be addressed in the coming months. But then there's this specific issue today of this incident. And, it sounds like from a state point of view, our hands are tied around not being able to waive a suspension and requiring at least a 1-day suspension. I would open it up to board members as to what they think would be appropriate. And it sounds like it could be as little as 1 day in this instance, in the absence of a policy to go by, and really can't even go by precedent because precedent was under a previous law. And so I think we can customize this solution, not necessarily bind ourselves in the future until we adopt a new regulation. Does that sound about right?
Nice summary. Thank you.
Yeah. So, I would be fine with a 1-day suspension, but I'm open to, given the circumstances, but I am open to a discussion.
I would concur with you.
Kevin?
You
Okay.
muted.
Go ahead, Carrie.
Go ahead, Kevin. You raised
I
your
was just
hand. You get to do that.
I was just going to say, can I ask Ms. Patel, typically on snow days, do you have very down traffic coming into your stores?
Yeah. Little
Okay.
bit, yeah. Because of this.
If the board so chooses, my guess would be you could make that suspension day tomorrow, which is a snow day, which may be less impactful.
Yeah,
if
that
you're
would
looking
be
to give some
great.
leniency here.
Yeah, that would be great. Yeah. Hello?
Yeah, we're here.
Yes.
Yep.
We're
We're
here.
just
Sorry.
thinking,
Okay.
just thinking.
So,
Okay.
I think that's a great idea, unless other comments from other board members or, yes, Kurt?
I'll just say that I think that, given the feedback from Ms. Busby and that the inspections have typically gone well and that our Reading stores are compliant, it sounds like we're in a good operating environment that warrants some leniency, and I'm comfortable with that. And Kevin's solution is creative. So
Like it. It's very good.
Okay, well, So,
Sorry.
yes, go ahead.
But I will say too, that, I mean, that is in no way suggesting that, we don't take this seriously, that, we're concerned about the impact on the business, but that the sale, that this is important to our community. We have a very active coalition and, we have a lot of concern about substance use in general. And, this is important to us, that our leniency is not in any way suggesting that this is not an important matter.
Absolutely. And I think a revised policy may or may not, and likely will not reflect such leniency on the first episode, but we can discuss that in the future and go forward from that. So I would make a motion that we mandate a one-day suspension of tobacco products for this violation, beginning at 12:01 January 7th for 1 day. And that would require Ms. Patel to, as Maureen mentioned, to be able to get all those tobacco products off the shelves in a box in the back room, before the store opens tomorrow morning.
Okay.
I would second that.
Second, roll call, Carrie?
Yes.
Paula?
Yes.
Rick? Yes. Okay. Ms. Patel, do you have any other comments or anything else you'd like to say?
No, no,
Okay.
and thank you so much on behalf of me and Nick. Actually, Nick is not here. He's working at the store right now.
Okay.
So that's why I joined the meeting.
Okay. Well, that's good. And you could pass this on to him, and you should connect with Mr. Solarin if there are any questions first thing in the morning.
Okay, yeah, sure. Thank you so
Okay.
much.
Thank you.
Yeah.
Thank you.
All right. And thank you, Maureen. It was very, very timely and very helpful.
Yes.
And thank you all very much. Nice meeting you, those of you that I hadn't met. And
Nice to meet
thanks
you
for
too.
your patience with the review. And please let me know if there's anything I can do in the future.
Thank you so
Have a,
much.
work,
have a good
Maureen.
night.
Thanks.
You can,
Stay safe.
Yes.
Thank you, Maureen.
Thank you.
Thank you.
Right, Kevin, anything going on at the coalition? New?
No, they canceled their December meeting. So they were, to quote, let me pull it up a second. They were up to their eyeballs in mental health first aid, helping out with the ESPERT program that they run at the school. So they just didn't have time to get a meeting in place. So we're on to the January meeting.
Okay, great. Thank you. I just want to mention that Jerry has a work meeting at 8 o'clock. So if she suddenly goes blank, it's not because she's out there looking for snow. It's because she has to go to a work meeting.
Thank you. Sorry, guys.
Well, thanks for showing up anyway.
Okay, a day incident command. What's going on there?
Not a whole lot. We have a new org chart that I would like to share with everybody. Jackie would put that on the screen for us. So this is what it looks like. Pretty much the health director is representing the Board of Health at the command level. So if you look at the command box, my name is the last on there as a representative of the Board of Health. We have used this org chart to plan a successful vaccination clinic and also a test kit distribution event. And it seems to be working fine, If needed, we will amend it, but for now, it's working fine. So that's pretty much the update I have on ICS. If anything changes, I will let everybody know.
Okay, great. I think Christine's name is spelled with a K, by the way. I just may want to
Yes, thank you.
correct that. Okay. A day on the monthly report.
Yes, so December was a little bit hectic for the department, but we were able to get all the school kitchens inspected, the 8 schools. They were all done in December. We had an emergency inspection at 162 Main Street. There was a sprinkler system dysfunction that got taken care of. We also had 3 complaint investigations that got resolved. That's pretty much it on the environmental health side. I'll let Christine and Shuang comment on the nursing part of this. Shuang, Christine?
Sure. Yep. Hi, good evening. This is a weekly nursing report. The date is 12/30/21 to today, 1/6/2022, for the town of Reading. It is COVID data based on Maven reporting and subject to change. The total case count is 3,731. Active cases right now are at 371. That's in 1 week. Deaths remain at 50. Transferred cases remain at 16. Number of recovered cases is 3,294. Hospitalization rates are increasing, and I am keeping data on that as well. The number of hospitalizations that I have documented are 12. However, that could be more as the information is ongoing. With regards to school update, I did not forward the slides that are typically sent to DESE weekly. Mary Juliana has been extremely busy with the school nurses. They're back from vacation this week, and she is going to be able to forward that report to me probably sometime tomorrow morning. I did provide a list of each school and the amount of cases at each school, but the total number of students that had tested positive for COVID from right before the break, the 28th of December through present day, is 263 students. The majority of the students are from the high school, and there are 28 staff members. At the present time, there is a cluster at Artis Senior Living, about 30% positivity rate of residents and 16% positivity of staff. A DPH outbreak specialist unit has been on site and conducted an inspection last week. I spoke with her and the manager of Artis Senior Living. At the present time, they have enough PPE. They are starting to run low on testing kits. They may, utilize the MRC. And I am in pretty close contact with AJ McDonald, who is the head of Artis Senior Living. So again, this is ongoing, and that's the numbers to date. There is another cluster at Reading Montessori School, as well as I was just informed of a cluster at the Goddard School. And if I could just briefly mention COVID vaccines, and I know that Shuang will have more to say on this. We received 200 doses of Moderna delivered to the health department today. We are in the process of scheduling clinics upcoming, and we will certainly be incorporating eligible criteria. We're reviewing protocol for homebound residents as well. We will incorporate that into the protocol, the program. And lastly, I would just say that we are working closely with Vaccinate RX and PalMed to schedule some additional clinics as well for the town. Thank you.
Any questions? Any questions for Christine before we? I had one question, which is, have you heard anything about, because this has been a problem in the past, besides daycare centers, has been the athletic teams in the school system. Has there been any major problems in the last week or two that you're aware of?
The last week or two, no. Prior to the school break, yes. There were a couple of different teams, both at Reading Memorial High School and at Austin Prep. This week, I have not heard anything. I do know that there is 120 pooled tests right now that are pending. And I believe tomorrow I will have more information.
And the other question I had was, I mean, with that huge number of active cases, what are we doing, or are we able to keep up with contact tracing? Or has that been scaled down, or how are you handling that?
So, yes, I honestly have been asking for help and have been receiving it from Elise Warren, Mary Juliana up at the high school. Shlung has been helping as well. It has been extremely difficult to keep up. We are keeping up with it. We're getting the information out. I think the change in guidance that just recently came out, a lot of the investigative work is taking a little bit longer, just because you know, when anything new comes out, it takes a little bit more time to explain. And then, of course, if there are multiple people in a household, you know, their isolation periods might all be a little different, and that can be confusing. The main mode of transmission does still remain household spread, and I am trying to keep as accurate data with that as well. There's a lot of home antigen testing that's being performed that is not reflected in Maven or the data that you know, I'm able to pull from a report. And we're still issuing, you know, guidance for those that call in, and so that is taking a little bit longer as well.
Okay, thank you. Sean?
Thank you, Dr. Lopez, and good evening, everyone. I have some good news to share with you about our COVID vaccine clinic. So today, we received 200 doses of Moderna vaccine. We ordered early this week. The distribution is efficient this year. That was great. And next week, we planned a booster clinic for our first responders on Monday morning. And we also planned a public COVID vaccine clinic on January the 13th. That's next Thursday afternoon with PalMed. When we receive the registration information from PalMed, we will post it on the website. And in addition, you know, our health department is working on preparing future COVID vaccine clinics. We are planning a potential clinic on January 18th or 19th. And we shall have the clinic information online when it's available.
Great.
Any questions? I will also forward the weekly nursing report after the meeting.
Thank you.
Thank you, Schwan.
a day. I actually had just two quick questions on the environmental side. One is, are we making any progress on hiring an inspector? Do we have candidates? Is that or is it flat?
So the vacancy got posted on the 3rd, I believe. And as of today, we've only had 3 applicants.
Okay.
I emailed HR to set up interviews. The applicants would not be my ideal candidates, but we're going to try to work with what we have. So
okay,
in the coming weeks, we will be having interviews for the 3 applicants.
great. And also, I know that this time of year, there's a process of reissuing permits. Is that, given how downstaffed we are, is that happening on schedule?
Yes, it is. Kim and Dawn, they've been terrific at helping out with the renewals. Things are going according to plans, so we're good.
Great.
Good news.
Good news. It's nice to have some good news. If there aren't any more questions.
I make it quick.
Sure.
I just wanted, Shuang, if you have any updates on test kits, or if you want me to mention it to the board, I can.
You mean the updates for the testing kits?
Correct.
Yeah, I know Ade was mentioned, we ordered some testing kits on last Thursday, and Ade may have some information, about the shipment.
Okay, so we should be receiving the test kits in 7 to 10 days. We're also working with regional partners to see if we can get some additional funding to buy in bulk. And once we do that, we can do some type of a community distribution event. So right now, we're trying to find the funds. I've reached out to a few towns and a couple of town managers, I believe. I've reached out to Bob. So hopefully we can come up with something. And I'll share that information once we get a figure.
That'd be great. Okay. In terms of, I'm going to move on. In terms of public comment, there any, there's one member of the public out there, Vlad and Becky Lieberman. Are there, did you want to make any statements, or are you observing?
I'm observing, but I would just like to reiterate what I wrote in a letter about my concern about the wording of when a mask mandate would be rescinded, because I was worried that it wouldn't take into account certain early warning indicators, like the wastewater virus levels. For example, right now we're seeing very high virus levels in wastewater, which that's an early indicator that we're about to see a big explosion in infections. So if I don't know what the new wording is that you're proposing for the indoor mask mandate, but I would just want you to leave it as vague as possible, basically responding to the current conditions, basically, so that you don't or say a new variant were to arise or something like that. You would just want to have the flexibility to be able to quickly do what needs to be done to protect public health.
Yes,
it will be rescinded if, I'm trying to remember.
It's Jackie just put it up on the screen.
Oh,
we basically left it open-ended, and so we can use all the data available, including the wastewater, including our, daily incidents and everything else that's going on. So we didn't want to box ourselves into some artificial.
Oh, that's perfect. It's just, I know it was a very rough cut, but what I saw on Monday made me a little bit nervous as an epidemiologist. But that looks perfect. Thank you so much. And thank you for doing this as somebody who studies pregnancy outcomes. And we know that COVID in pregnancy is so dangerous. So that's a vulnerable population that people don't think about. They're also a highly under-vaccinated population. So the only other thing, it's great that you're having these clinics. If there's a way to disseminate more information, that would be excellent too. It happens to be Birth Defects Prevention Month, January. So if you are on Facebook, if you want to go and like the Massachusetts Center for Birth Defects Research and Prevention has a page, and with helpful tips, take your folic acid. If you're pregnant, planning to become pregnant, discuss getting vaccinations with your doctor, including COVID vaccination. So just putting that shameless plug for to try and, because there's nothing more important. Thank you.
Thank you.
Thanks.
Thank you.
Becky.
Thanks,
you
Becky.
for your feedback. And Becky, if you have any pull at DPH and could do a statewide indoor mandate, feel free to
Yes.
try ahead with that.
It's up to the governor.
Yes, I know. Okay, so we've come to the conclusion of our meeting. Our next meeting is in a month, unless something else happens.
Don't jinx us.
I'm done with meetings.
We were originally planning to hear from Mark Fine and the MAPC, and so I'm hopeful that at next month's meeting we can get their initial draft and focus a little bit on that, and we'll see what else comes up in the meantime. Any other actually agenda topics that, again, if you have ideas about agenda topics, please, send them to a day or to me or both, and just so that we can get them on.
I just had something maybe that this board might like to put on for future agenda topic, talking about more of a broad campaign, not something that's, a one-off, something that's more of an ongoing annual thing. One thing we haven't had the time to do over the last 2 years is really come up with a well-crafted health and wellness kind of campaign and program, centered around all sorts of different things that we've occurred or have occurred during this pandemic. Things when we've seen comorbidities really be affected by this pandemic. And, this board, and on the number of years that I've been on it, we've never had the opportunity or chance or maybe the wherewithal to put some kind of program together like that. It may be something worthwhile moving forward, something that really is a kind of a true health and wellness to try to boost immune system, try to reduce things like smoking and obesity and things of this nature that, I would feel falls in line with what this what the board's mission should be in regards to the health and well-being of the residents. So just while we're in the middle of an unprecedented spike that we haven't seen during this pandemic, just a little food for thought for something that maybe we can put together in the future.
Okay, I totally agree with you, and I think that what the projection that sort of I've been working on is, with COVID on top of everything else, but was to understand from the MAPC assessment, where our strengths and weaknesses are, where additional resources have to be, and to also with a day coming on, getting his sort of feet on the ground and replenishing the department. All that I'm hoping we get done in the next several months, and I think then doing a community health assessment, which is exactly, Kevin, what you're talking about.
Okay.
Looking at health and wellness and not just reacting to inspections and COVID, but really thinking about what are the factors we can work on. I mean, the last time that was done by this board was in 2015. And it was a 5-year plan, so it's expired, well expired, and other cities and towns have done that, and we ought to be able to do it as soon as we're, a little beefed up and ready to go.
Yep.
Great.
Thank
I think it would make a big difference.
Yeah, I think it
One
will.
of the ideal outcomes from that community health assessment will be the ability to do that targeted health communication, to address the issues specific to our community. So
Absolutely.
that'll be
Great.
great.
Paula?
Dovetailing on that, I am still hoping to
Yay.
take the foundations course
Oh,
and sort of summarize it for the public as a means of health and environmental education.
excellent.
I'm so glad. I
Great.
thought that was such
I'm
a great
still doing
idea.
it. I'm still doing it. I'm almost
Good for
done.
you. Good for you.
That's great. That's excellent.
Just quick comment, great idea by Kevin. I think that once we move to the police station and we are in close-up proximity to the coalition, some of these things you mentioned will be easily achievable.
Yeah. Okay, great.
The second thing I would mention is right now we are in a transition. So we are going into a new online e-permitting system. So we have to transfer our paper applications to digital applications. So that takes a lot of work. We're doing that right now. We're also going to be updating the website to Civic Plus. So those are two main endeavors that they're time consuming. So I don't see that happening. What Kevin mentioned, I don't see it happening anytime soon. Probably later when around summertime, we can start working on that. But the most important, the priorities right now will be, one, to make sure we fully transition into the online permitting, one, two, upgrade our website completely, and three, I would like to, at every meeting, review our regulations. So for example, maybe at the February 3rd meeting, we can review the swimming pool regulation. March meeting, we can do the tobacco review, just for everybody to be on the same page, and then look at things that don't apply to our town and get rid of them.
Yes.
And new things that we would like to add. So that's my mindset for right now.
All right, great. Great idea.
That sounds wonderful, Ade. And I mean, the upgrading of the website, I think that's a step in our health communications piece. That's always been kind of a challenge for everybody. So being able to have the underpinnings sorted out before we start trying to run, I think that's great.
Exactly. Yeah.
I spend a little bit of time, but always looking at other boards of health websites, and in general, it's kind of pathetic. They're frequently the information is old, frequently things aren't updated. And it would be great to have like a sterling website for our community.
Absolutely. That's the goal.
Nice.
Yes. Awesome.
All right. Motion to adjourn.
Oh, real quick. Sorry. Ade, are you going to look into that reverse 911 tomorrow morning? Okay.
Matter of fact,
Just wanna
tonight,
make sure.
once we get off
Okay.
this meeting, I'll call Chief,
Great.
and we'll go from there.
Excellent. All right, great. Adjourn away.
Motion to adjourn.
Second.
Roll call. Carrie,
Yes.
Paula,
Yes.
Rick, yes. All right. Good night, everybody. Thank
Good night,
you.
everybody.
Good night, everybody.
Good night. Thank you. Bye.
Thank you.
Stay safe.